Is hydroxychloroquine a miracle drug or a death pill? The debate is raging yet again, and this time more than 100 scientists have questioned the authenticity of a hospital database that formed the basis of the popular Lancet study which was published last week. The study concluded that treating coronavirus patients with hydroxychloroquine could increase their risk of death. A report published in the New York Times now says that these scientists want the Lancet study to prove the details about the source of the data that the study had. And now it has also called for the study to be independently validated by the World Health Organization. Now remember, the WHO earlier temporarily suspended hydroxychloroquine trials amid safety concerns. And in response to the latest developments, Lancet paper's lead author, Dr. Mandeep R. Mehra, has asked for an independent academic review and the audit of their work. It will not be wrong to say that Lancet is one of the world's oldest and best-known medical journals. And the study in question involved close to 96,000 coronavirus patients spread across 6 continents. Those who got the chloroquine or the hydroxychloroquine treatment were more likely to die, and they were also at a risk of developing abnormal heart rhythm. Now the question is, what made scientists skeptical about this Lancet study? The paper was published on May 22nd, and data taken into consideration was still April 14th, which means that the authors analyzed a trove of data, wrote the paper, and went through the journal's peer review of its findings. Now, in just over 5 weeks, much faster than usual, the author of the study has also refused to identify any of the hospitals that contributed patient data, or to name the countries where they were located. It is important to note here that hydroxychloroquine caught the world's attention when the United States President Donald Trump touted it as a wonder drug. Trump on multiple occasions accepted in public that he was personally taking HCQ. And the American president is not alone. Brazilian President Jair Bolsonaro has also continuously vouched for the benefits of hydroxychloroquine. This despite the World Health Organization suspending the trials. But where the world gets its supply of hydroxychloroquine, India is the largest manufacturer of this anti-malarial drug, and it exports it to 55 other countries with explicit guidelines. The use of the drug has to be preceded by an ECG or an electrocardiogram test to check for heart conditions, and vulnerable groups are advised against taking this drug.